abuse, cancer,
measles, diabetes, AIDS, cancer.
Good evening once again, and welcome to another live Doctor on Call. It is a pleasure, as always, to be here with you on a Tuesday evening to share information that can help, improve our wellness. It is so important. Our health, as is always said, is our wealth. And of course, the importance of protecting your wealth and trying as much as possible to increase it. So if you can improve your health and make yourself healthier, or to be the healthiest you can, now that is real wealth. And that's what we aim to do by sharing information with you. We welcome all our viewers on GBN Television 7 and 11, our listeners on K105 FM, and also our friends on our Facebook page and our YouTube channel. Dr. Nixon's with us as always. Doc, good evening. And how was your weekend? Well, your week since we last spoke on the program. How have you been? I think you're still muted. Right.
Good evening, everyone.
There we go.
Good evening. Good evening to people in diaspora. Good evening to everyone. I'm always heading to perfect, so it's kind of hot tonight, but
yeah. Actually, today was warm as well. Yeah. Well, we're into the dry season, and so we have to be prepared. Because, sometimes it can get really, really uncomfortable with the high temperatures. And, of course, we know some of the impacts of climate change with global warming and all of that. So we have to be prepared. The importance of wearing appropriate attire to keep us cool as we can, And, of course, Doc, as you always remind everyone, don't forget to remain hydrated. This is so very important, at this time of the year. And we are also in Independence season, so it's also a celebratory season for us. And there's going to be a lot of oil down, there's going to be a lot of, you name it. In fact, come next Saturday, the 31st, GBN's Oil Down Fest will take place on Pearl's Airstrip. So, Doc, I'm promising to take you up there so we can enjoy some good oil down. I'll give you one dumpling, one slice of breadfruit, and some meat and some vegetables.
Mm-hmm.
That'd be wonderful.
Thank you.
Huh? All right. So, folks, last week we started the year with a very, very, very interesting program, talking about the importance of, testing and all of that, getting your blood test. And because a lot of the time we're all guilty, you go to the doctor, and to ensure that the physician is certain as to what is going on and to be in a very good position to treat whatever it is, you're asked to get a blood test done, so that the markers can be identified and so you can be treated appropriately. And sometimes we don't go. We figure. I can go and pay $20-something to do a blood test, and you just don't bother, and you probably go home, you drink some bush, you do whatever, and then you feel okay, and then you think that's it. But let me tell you, it doesn't work that way. It's important, and and I think a lot of information was shared last week by Doc regarding blood tests and so, and we want to continue along those lines this evening. But of course, looking at the development through the ages. From the moment you that egg and the egg and the sperm comes together, the development of the embryo and all of that, and then you become a little whatever it is, as they say in the movie, a little goo goo gaga, bathing and dribbling all over the place, and then you start to take shape and run around and pull down mommy cabinet and break this and break that and do all kind of funny things, and of course the development process start. But while all of that is happening, it's also important to pay attention to what is happening around you, because a lot of things can happen which can create little problems here and there. Doc, it's like you buy a brand new vehicle, working fine, sounding great, but one little nail in the road can put you on the side of the road for a good hour and a half.
That's you, because you can't change your tire.
No. I have moved away from changing tire. I just press some whatever it is, and it seals that hole.
Look at that modern technology.
And I'm
got you
on the road again. So, Doc, I would like us to continue along those lines and. Talk about these things. What are some of the major things that can affect us? Even at that tender age, and how we deal with them as we develop through the ages.
Okay, so good evening again, everyone. And look, there's always a lot of information to share. Sometimes we repeat, but we try to look at the information from as many angles as possible so that everybody can understand. It's a lot of information. I know this is not medical school, but guess what? We're all in school, and there's lifelong learning. As long as you're alive, you have to. We're learning. So we want to look through the life cycle from conception to the end of life. Where we reach tonight, okay? So we always talk about a baby being a host in a healthy mother. Because a baby that grows in an unhealthy mother is likely to be unhealthy. A baby that grows in a mother who has diabetes or who has hypertension, a mother who uses substances or who has HIV and other syphilis. These babies face challenges for their own lives. So we have a mother who's pregnant, and in order to be able to monitor the state of well-being and to ensure that baby, when the baby is born, to ensure that he's healthy, he or she, let's say he, right, or it is healthy, we go through the mother. There are things we can do for the baby directly, but like I say, when you first conceive, you're less than a dot, right? But there are changes that will occur in the mother's body that we can monitor. We ask that women who think they may be pregnant, so once you miss your period, if you know you're not using any protection and you're having intercourse, if you're planning to have a baby, you're trying to have a baby, once that first period goes, go find your doctor. Once you don't see a period the first time. As a matter of fact, every woman should go to the doctor once they missed a period. Okay? Some women are accustomed and they understand that. If you're not sexually active, it's a different story. But if you're engaging in sexual activity, then there's always a possibility of you being pregnant as a young woman in a reproductive age. So let's say you're pregnant. What happens? So there are things the doctor is going to ask you to do. There's a batch of tests that you actually asked to do. Apart from getting your weight and your blood pressure at that first visit, because that is kind of like setting up a baseline. And like I said, ideally the 6th week, certainly by the 12th week after your last period started, you want to make sure that you see the doctor or the nurse in the health center. Right? Because our nurses are very well trained, especially our midwives, very well trained to monitor pregnancies and to get to a normal, healthy delivery. Okay? So, what do you want to do? Weigh the woman and check her blood pressure. Is her blood pressure high already? We're in trouble. What is that baseline blood pressure you get? Because as you go to the doctor more regularly, because you really should go every 4 weeks, as you go to the doctor, your blood pressure will be monitored. And also the nurse will check your urine to see if there's any protein, any blood, any sugar in the urine. Those are things that are going to happen on a regular basis, right? So sometimes we don't ask, but we really should, and we should know what's going on. What is nurse looking for in me? You don't want a mother who's pregnant and a woman who's pregnant having high blood sugar. That is detrimental to your baby. Most women who have elevated blood sugar or who develop gestational diabetes or who may have diabetes anyway, right? Gestational means that it happens during the pregnancy. It appears, and when the pregnancy is over, it tends to resolve. Those babies are really big because they get all that sugar from the mother's bloodstream. So you get these big babies who have high blood sugar. When they're born, the source goes away. There's no source when the baby is born, and the baby can get low blood sugar and can die, okay? Because there's no sugar for the brain to work, and the baby can die, right? Or the baby can have severe damage to the brain. Right, so you want to make sure that you monitor the mother for whether she has sugar in the urine. So the first thing to do is look for sugar in the urine. If we see sugar in the urine, then we go to the blood. But there's a batch of blood tests we do, and it looks like a lot, but there are explanations. So you do a full blood count, or just do a hemoglobin. Full blood count gives you everything. It tells you what your white cells look like, what your red cells look like, whether your platelets are okay. And that's where you can already eliminate some diseases, right? Anemia, leukemia, other diseases, right? Are you having some infection somewhere? What is going on? That is what a CBC will tell you. And then you have to do a sickle test. And we've spoken about sickle cell here as well. Sickle cell is a disease that occurs in 1 in 15 people who look like me. Okay, people of African and some Indian extract. Okay, East Indian. People from India, right? And those are the Eastern world. Okay, there are other blood problems, what we call blood dyscrasias that happen, hemoglobinopathies that happen, but sickle cell is the most predominant one. 1 in 15 persons will carry that sickle cell gene. Okay, but you want to know, and if a mother has a sickle test that's positive, you want to test the father, because if the father have a positive sickle cell test, let's say they're both just carriers, there's a 25% chance that child is going to have full-blown sickle cell disease. So you already know what you're working towards, how you prepare to receive this baby. Okay, so you do a sickle test on the mother. You do a urinalysis, and I just thought we check the urine. Mm-hmm. You do an HIV test. You do a HTLV test, which is like cousin to HIV, very common among the West Indian population, and can cause you to have cancers. Okay, and then you do the mother's blood group, just in case, and for more than one reason. But the HIV test you need to know, because we have been able to eliminate transfer of HIV from mother to child. Okay, because there are things you do. If you're diagnosed with HIV, remember the mother and the baby may share some bloods at some time. The mother starts taking the antivirals, and the baby has to be delivered by C-section so that he doesn't come down in the passage and you have blood flowing back from the mother through the umbilical cord and infecting the baby. So all of those preparations, and that is why we do that, so that if a mommy has HIV, we give her medication to decrease the load of the virus, the amount of viruses she has circulating, and then we know what we're going to do. Right? After a while, she has to take medications, and this baby, certainly two things. It's going to be delivered by C-section, right? And the second thing is that the baby is not going to be breastfed. So we have to make preparations for that, tell a mother. And some mothers do want to breastfeed their babies because it's actually easier to do, and it's more convenient. You have to wash bottle, it don't cost you anything, and it creates bonding and stuff. But in the case of an HIV mother, she doesn't. So you want to know, and that is why it's important to go to the doctor early, so you can figure out all of these things and not put your baby at risk, and make sure that your health state can be stabilized. Okay. We said when you did urine, look for protein and sugar, and of course we weigh the mother, because if you weigh 110 pounds at the beginning of your pregnancy, you're supposed to weigh 140 pounds, more or less, 135 pounds by the end of your pregnancy, right? You have to put on like 20 to 25 pounds between baby weight, water, placental weight, put on a little fat or whatever it is. So if you go to the antenatal clinic and you weigh 110 pounds, and you're healthy 110 pounds, but at 34 weeks or at 20 weeks, you haven't put on any weight, that's cause for concern. It's a baby growing, because you don't want to have a baby that doesn't develop properly. You worry about whether the baby's brain is going to develop, whether the organs are developing, what's going on here, right? But then again, you might have a mother who puts on a lot of weight, and when you check, she have more than one baby going on inside there, okay?
Right.
Right? And so we also do blood tests for other infectious diseases. Apart from HIV and hepatitis, we do both hepatitis B and C, okay? If you've been vaccinated against hepatitis B, then you don't have to do the test. And of course, we do syphilis. There is not as much syphilis as there was 20 and 30 years ago, but there is syphilis. Mm-hmm. And babies who develop syphilis in the uterus, who get it from the mother, get what we call congenital syphilis, and they have a lot of malformations in their face and their brain and stuff, right? So there is children who are born with neonatal syphilis and who need special care, okay? And who you need to figure out what's going on with the beginning, what is the level of the organism in their blood, blah, blah, blah. There's management for that. So those are the things you do. So it's not just having a baby. When I'm ready to have a baby, I'm just going to the hospital. Yeah, no, that's not what it is. It's going to take. The other thing is that the doctor needs to measure the mother's, the height of the uterus, right? And there's a certain height that corresponds to a certain date of amount of weeks in your pregnancy. So for example, you may be at 12 weeks, which is 3 months, but you have this big uterus up to your navel, which is like 20 weeks. Oh, maybe you have 2 or 3 babies in there. Maybe you have a fibroid or something else. So there are things, and I guess your doctor will send you for an ultrasound. There are other tests that can cause challenges. So the other tests they might have to find, because sometimes there are malignancies and other benign challenges that occur in the uterus that look like a pregnancy, that originate from a pregnancy, but that is not a pregnancy, like a hydatiform mole, which can be malignant. So mothers have a little more vomiting and the pressure is higher, and there's signs. So those are things that you need to know about, right? And some women say, but when I get pregnant, I vomit and I vomit and I vomit. Yeah, but maybe you get pregnant and you vomit and you vomit and you vomit, no, and you do have a problem. Okay, you do have a malignancy that's growing in the uterus instead of a fetus. Right. Okay, and that can kill you, right? But you can have surgery and be fine. And so that is why it is so very important to go for antenatal care. There's one more thing I wanted to say. We talked about having underdeveloped babies, multiple babies. In certain age groups, you might have an ultrasound done early, because we know that some women have Down syndrome babies. The truth is, Down syndrome babies is not really just limited to women who are older. As a matter of fact, most of the women who have babies, the more babies you're likely to have, is the more the chances of you having a baby with Down syndrome. It's as simple as that. Okay. The other thing is that older women tend to have multiple pregnancies, so you have to much older women. So you have to make sure that you screen, you do an ultrasound, and in the case of HIV, you need to probably repeat the test at the end when it comes closer to the end of the pregnancy to make sure the titers are very low, right? So the baby is not at risk. So those are the things. Right. Besides that, you really want to make sure that it's... Go on.
Yeah, one quick question. So while we're on babies, what would you say, Doc, is the... And we're looking here to get to have the healthiest babies possible. What would be the suggested age, let's say for a young woman, to conceive? Like the age range?
Okay. I like early 20s, but I like early 20s that have sense.
Okay.
You kind of need to be in a psychological space that you're prepared, that you've gone to school and your college. You go to college and you plan to have this baby, so you're eating properly, you're taking your folic acid and from long before, because you're preparing to have a healthy baby, right? And no, we don't really do it like that most of the times, but that is the ideal thing, that you can plan to have a baby. Okay. In the case of having folic acid is very important. Taking folic acid before, because it helps with the development of the baby's vein. And you know what's funny? Because the brain is the first thing to develop. So you want to make sure that in those early stages that you might miss, right, that everything is fine with you. Because if you don't check yourself until the 8-10 weeks, the brain is already developed.
That's started to develop. Okay. Mm-hmm.
Right? So it's already formed and well developed, because there are changes happening in the body you start with one cell that multiplies and gives 2, that multiplies and gives 4, that gives 8, that gives 16 or 32. Then you get this ball, and the ball separates and it invaginates and it forms the spinal cord and the brain. That's the first thing that's formed. Mm-hmm. And intelligence, whoever makes it, God, whoever makes it, the hormones affect that things happen, the placenta gets formed early. I want to make sure that you're not weak.
I don't want to get too scientific, but I just want to ask. So you mentioned the brain and the spinal cord. Which develops from which? Does the brain develop from the spinal cord, or the spinal cord develop from the brain?
They develop together from the same set of cells.
Okay, all right.
So imagine you have a football, right? A ball, a softball, a balloon, right? And you take the balloon and you squeeze it in, and you have a thing in the middle, right? The part of the ball in the middle, which eventually separates from one side, so the outside joins back, and you have that tube in the middle. That's what forms the brain and spinal cord.
Okay.
Forms the neural cord, right? Okay. So, but that's early. That's the first thing. After all these cells multiply, form a big old ball that invaginates, and you have this tube in the middle. And from that, so the brain and spinal cord are related. They come together. They start being formed together as one. They place along the spine, right, along the back of what will be the back of the fetus, which will become the back of the fetus, and it grows from there. So that is why it's so very important that we prepare our bodies for pregnancy. We know we can't be drinking and smoking, and all of those things are things that women have to eliminate in their lives when they want to have a baby. If you smoke, it makes your blood vessels get small. The nicotine makes your blood vessels get small, and you don't get good perfusion, so the baby can be small, right, for dates, or the baby can die from lack of oxygen, right? Especially if you're an older person whose placenta may not be as, the perfusion, the exchange of air and food may not be as efficient as in a younger person. So you want to make sure you're not smoking, you're not drinking, you're not using illicit drugs, okay? And that your nutritional state is good, because you have somebody else to eat for, all right? Yeah. So the other thing is that the nurse wants to hear the baby's heart. We can hear like about 16 weeks, right? 4 months. That's when you start the heartbeat. If you use an ultrasound, you will see the rhythm and hear it faster. Okay, but just hearing it to the old method is 16 weeks, and then the baby starts moving around that time. Right? No, you can hear the heartbeat a little earlier than that, but at 14, 16 weeks, you start feeling movements of the fetus, and you want to have movements. You don't want to have too little or too many. Okay. But like I said, the baby will be evaluated. If you go to antenatal care, as you should, right? Doctor might send you back for bloods. Let's say, for example, you develop what we call gestational diabetes that happens in the pregnancy that appears. You need to see a doctor a little more often. You have to go on that. Some people end up going on medications. They put them on metformin, right? And you have to follow, because you don't want that baby absorbing all that sugar that comes in the mother's bloodstream, because it becomes a very, very big baby. And like I said, when that baby is born and that source is cut off suddenly, the baby can crash into low blood sugar. And that's why we need to know, so we can make sure that when the baby is born, somebody's there, one, to test his sugar, and two, to make sure that his blood sugar is maintained at a viable level.
Okay, lovely. So
what do we do with our babies after that? When they're born, we do some. Here we just test for syphilis, we still do tests for sickle cell.
Right.
So the mother might be negative and nobody thinks about checking the father. But the father might carry the sickle cell gene and the baby might have a sickle cell gene. So here, there is a program where the babies are screened at birth for sickle cell disease. So antenatal care is not a simple thing, right? But it's something it's not complex, because if we allow ourselves to be guided by the professionals, it becomes easier for the mother. Okay? Your blood pressure needs to be checked regularly, because blood pressure in pregnancy, preeclampsia or eclampsia, where the mother starts having seizures, can be fatal. Right? Can be fatal for the mother, can be fatal for the baby, or both. So you must monitor your pressure. And remember me telling you that you need to have your pressure checked that first day as a baseline? So nurse should check your pressure, and when she checks your urine, she looks for protein in the urine, right? She looks for protein in the urine, and if there's protein, there shouldn't be protein in the urine unless you have urinary tract infection. Yeah. So that will also be looked at, or you have kidney challenges, right? But if there's protein and your pressure is going up, those are two signs that you have preeclampsia. So the mother will be monitored well, her blood pressure will be controlled with medications and stuff, right? Because if you have eclampsia, in a very complicated state, you can go into coma, you can have brain challenges and all the rest, right? And of course, we can lose our baby.
Right. So I just want to spend a minute on the protein, and this is very interesting, because it seems to be a common thing when someone is sent to get a blood test. You see that protein there.
A urine test.
Yeah, a urine test. But also, did you say that it can also be an indication that there could be issues that are kidney related?
Yeah, especially if you have hypertension, you will do a blood protein level. You will have to do blood protein if somebody is persistently spilling protein into their urine. If their pressure is high, if they're diabetics and they have sugar, they may have kidney problems already. So you want to make sure, and you'll do kidney function tests. You can do ultrasounds of the kidney and everything to look at see, because having protein in your urine is not normal.
Okay. All right. Very good. Right. Yeah, I just wanted to clear that.
So the other thing we want, when you're born, in some communities, they do genetic testing, okay? And they do other tests like hearing, vision for the babies, right? They might do chromosomal testing as part of genetic testing. You might look like you have Down syndrome. Some people would like to do in pregnancy, gestational tests for Down syndrome, and you can do that. You can get some fluid from the amniotic fluid and check it out. And technology is so advanced, because there was a baby who had a congenital heart problem who had surgery in the mother's womb.
Really? Interesting.
One Nigerian surgeon did this probably like 3 years ago. 3, 4 years in the last 5 years after COVID, certainly.
Yeah. But here in Grenada, right? Yeah.
No, in the U.S. Okay. But what I'm saying is that you discover challenges if you do diligence.
Right.
If you do diligence by going, and asking your doctors and ensuring that your doctor gives you the kind of check that you need, then you will discover whether you have problems or not. Right? And not like you go when in your 12th week, let's say, and doctor send you for a test, and you don't go for the test until you're 30 weeks, and that time your sugar high, your pressure high, and all of, you understand? And the poor baby's under all of that stress, which can be eliminated. And of course, like I said, if a mother has a complicated pregnancy, there are preparations that are made. This baby's coming from a stressful environment. We may have to do a C-section on a baby. We may have to take that baby earlier. If you have a very large baby and a very small lady, you might want to have a C-section, where she would normally have a vaginal delivery. So there are a lot of layers on that onion, but it has to do with, am I going and getting the kind of care I need to make sure that I have a good person? Right? So when my person is born, and in Grenada, I think it happens, we strive to have 100% of our deliveries within a clinical setting set up with standards by the government Ministry of Health. Most people are born at the general hospital. There are some birthing centers, but I don't know whether they're used as much. but certainly we have nurses, we have midwives who focus on pregnancy as a specialty in their area, and we have other nurses who do general nursing and midwifery, but there are nurses who are just midwives, and that is their
that's their responsibility.
That's their responsibility. So I would want, if I were pregnant, that a midwife takes care of me. The gentler the nurse, and they're very aware. They look for everything because that's all they do. Right? Figure out what goes on in a pregnancy and make sure that we can have a healthy baby.
Okay, great. So Doc, at this point, I think this is really excellent. Let's just take a very quick break, and we're gonna come back, and then we would look at that baby's born, fine, he's okay.
What we do in the hospital?
What happens? Yeah. So we take a short break, and we'll be right back. Stay with us, folks. Don't go anywhere.
$10 on Playway, $20 backup on Pick 3, and cash for each, please.
Okay, are you adding multi-X to your bet?
Yes, multi-X, all of them.
Smart. Best value bet. Backup and multi-X. You cannot go wrong.
Don't matter the bet, multi-X all of the daily games.
With multi-X added, your winnings can be multiplied 3 times, 5 times, even 7 times. So make it a rule. Add multi-X to all your Playway, daily Pick 3, and daily cash for bets every day and for every drop, and watch your money grow. Available at stores and online.
You heard it here. Multiply your winnings daily. Must be 18 or older to play. NLA, making your dreams come true.
Hello and welcome to the live Super 6 draw presentation for this evening, Tuesday, the 20th of January 2026. I am your hostess, Kijan Smith. Super 6 is a multi-jurisdictional game owned by Winlord Inc. and is played within the islands of St. Vincent and the Grenadines, Dominica, Grenada, and St. Lucia. Tonight's jackpot is valued at $230,000. We'll now get ready to select your free ticket letter. Good luck. Your free ticket letter is C. Please stay tuned. We'll be right back with tonight's winning numbers.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Now you love Super 6 even more. With more money,
the jackpot galore.
Play more,
win more, have more fun.
With more jackpot money,
Super 6 is my number one.
With the new and improved Super 6 team, the jackpot keep growing and growing
and growing.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game. Super 6, bigger jackpots, more chances to win.
Great news about Super 6. You can play Super 6 combo bets to increase your chances at winning the Super 6 jackpot. Here's how. The combo 5 betting option costs $69. Players have a choice of any 5 numbers, and if you match 5 of the with 6 numbers, you win the jackpot. Maybe you prefer combo 7, costing $21. With a choice of 7 numbers, and if you match any 6 numbers out of the 7 numbers, you win the jackpot. How about combo 8? This option costs $84. Players select 8 numbers, and if you match any 6 numbers out of the 8 numbers, you win the jackpot. All numbers chosen should be from a range of 1 to 28. Play combo bets. Remember, with Super 6, there are bigger jackpots and more chances to win.
Welcome back. Get ready for your Super 6 winning numbers. Good luck. is 18. To recap, your Super 6 winning numbers are 3, 23, 17, 16, 12, and 18. Your free ticket letter is C. Tonight's winning numbers were drawn under the supervision of an auditor from BSA Consulting. Please contact your relevant Central Lottery office for further information on the payment of prizes. Thank you all for playing, and remember, with Super 6, there are bigger jackpots and more chances to win. Our next Super 6 draw takes place on Friday, the 23rd of January 2026. Until then, have yourself a wonderful evening.
What if you had a choice? A choice of joining a line or a choice of making your purchases online? What would you choose? While you ponder on that, the National Lotteries Authority has provided another purchasing option. All their games are now available online. Yes, Grenadians! From wherever you are, purchase your favorite daily and jackpot-type games using any electronic device. Register on the NLA's website at www.nla.gd. Top up your account and enjoy online lottery gaming at your convenience. We're taking shopping comfort up several notches. But the choice is yours. Join a line or buy online. NLA, make your dreams come true.
Welcome back, everyone. It's Dr. and Call, and we're talking about the the life cycle, and we just discussed a whole lot of wonderful stuff, a lot of great information about the baby and what is important for the mother during that period of pregnancy. And so we're going to move on to the next stage, which is birth. And of course, after the baby went through 9 months, inside of its mother, he's now out. And of course, we have to make sure that from the time he puts his head out and then he starts to cry, or he takes that first gulp of fresh air, things are in place so that there are no complications. Doc, the baby's born.
So in pregnancy, we would have wanted to make sure that this mother, discuss things like breastfeeding, which is one of the things we want to do, right? So we discuss breastfeeding, we discuss just general nutrition. We're taking your baby, how to care for the baby and all this stuff. One of the things that a midwife should be doing, or the nurse who sees the mother during pregnancy, is to start to give her a hint as to what a breast should look like, breast care and all the rest, because that is very important. Okay? Mm-hmm. That is very, very important. Now, if the mother, when a baby is born, we are breast friendly. We have signed up to the World Health Organization breast friendly hospital thing, right? So all mothers should be encouraged to breastfeed, unless, like I said, there's exceptions. Mothers who, if a mother is very ill, if a mother has HIV, etc., right? And you may have babies who have some malformations, like babies with cleft palate and stuff, that you have to have special way. But even so, you can extract milk from the mom in order for the baby, because it's so very important to get that first thick yellow secretion, that colostrum. Okay, it's very, very important to get that. So in the first thing, you have to make sure that this baby can breastfeed. And you want to put baby to mother, so there's bonding, and the breastfeeding starts right after birth. But then your life comes into the life of vaccinations. After we've screened our baby for, like I said, we do it in Grenada, for sickle cell, you will get before you leave the hospital, you spend a day or a day and a half at the hospital after you're born. So that we could follow mommy's pressure. If the mother's pressure is higher, she might stay. If her sugar is out of control, we keep a little to see how she settles down. She's had a C-section. So there are those exceptions. But for a mother who gives a normal birth to a healthy baby, go home and enjoy yourself, okay? Go home and enjoy this new member of your family. But baby gets his first hepatitis B shot of 3 before leaving, okay? And so until this child is like a year and a half, 2 years, up to 4, actually, there are a series of vaccinations that this baby needs. But we also a baby might come with challenges. Suppose the child has sickle cell. Mm-hmm. There must be a nutritional pattern that he has to follow. Okay, we don't give iron to sickle cell people, even the carriers. We do not give iron to people who have sickle cell. We do not give iron to people who have sickle cell. If the mother was diabetic, you still want to make sure that baby's sugar is balanced before you send him home, okay? So, in the first 4 years of that child's life, the first few months is getting to adjust. Breastfeeding, if not breastfeeding, guiding mom as to how she should feed this child. And there are vaccines that he gets. Mother goes back to clinic in 6 weeks to see whether baby has grown or not, whether baby has any challenges, right? And she can always go back. And then mom gets a pap smear done in the 6 weeks after she's given her birth. So those first 4 years has to do with very important development. Because when I was talking about having healthy people, we talk about the home environment. Is it stable? Are people smoking in there? Is there bang-around music playing outside? Is there running water, right? Or at least clean water? Is there electricity? Do you have to jump over a stone to get into your house? Do you understand me? Mm-hmm. Is it safe for a baby to crawl around? Or do you have cockroach and rat and all kind of stuff running through, mice running into the house? Is rat going to bite your baby toe? Okay? Those are the things. But generally, nutrition and vaccines.
Right. A quick question. Yeah, a quick question. While we're at the hospital, there seems to be a common thing with a lot of babies. I've heard it quite a lot. Babies are generally born. Well, no, I shouldn't say that. I think I'm stepping out of my line here. But we've heard of babies being born with jaundice.
Okay. Oh, so that's one of the things. Mm-hmm. It is normal for a baby to develop jaundice after day 3.
Okay. Why?
Because babies have you get all this blood from your mother, and some of the cells actually break down. And that's where the jaundice comes from. Mm-hmm. You worry if the jaundice is early and very intense, because sometimes you have to do what we call an exchange transfusion. You get blood that doesn't have bilirubin. Bilirubin is that which causes the yellow pigmentation. So it's a product of the blood breaking down. And so you get blood, you take out some blood from the baby, you put back in that new blood that you get from the lab. Take out until you get it balanced.
Mm-hmm. Okay.
Right. And the baby who starts having jaundice on day 3, 4, mommy takes him out and get a little sun, and you encourage to breastfeed a lot, right? So that baby is properly hydrated, and that jaundice should go away. But if you see jaundice early, or even if you go home and jaundice comes whenever you go home and it's intense, you have to take the baby back so the doctor can examine the baby. Because the other things that happen are you have congenital problems like biliary atresia. You have other diseases that a baby can have that can cause him. Sometimes some forms of infections can cause babies to have severe jaundice. And high levels of jaundice will cause brain damage by staying in the brain. Okay? So you can have children who have mental, developmental, and learning disorders as a result of having had high jaundice. So it's very important that mothers should look out for that so that their babies get a fair chance. Okay. The other thing is, oh God, it keeps going away from me. Something I wanted to talk about during pregnancy. It will come back. All right? Oh, infections in pregnancy. One of the things that a lot of women have is miscarriages. Mm-hmm. I'm not talking about women who make an effort to terminate a pregnancy. I'm talking about some women. They have threatened miscarriages for whatever reason. It is not smooth sailing for everybody. So that's one of the things. If you start having cramps, low abdominal cramps, or you start bleeding, a mother should really a pregnant woman should seek care, even if it's early in the pregnancy. Okay? So sometimes we miscarry, or we have a spontaneous abortion, which is what it's called, right? And, but often it's fetuses that might have challenges, so they're not compatible with life.
Oh, okay.
The other thing, we're talking about group and factor. I wanted to tell you because you want to know what the baby's blood group is, and that would also depend on what his father's blood group is. So if you have a mother who has negative blood and she has a baby who has positive blood, right? You want to make sure that you can test that baby at birth. Or you want to test the mother's blood. If she's negative, you have to give her, and the baby is born positive, you have to give her a vaccine because she will develop antibodies against her own, right? Mm-hmm. She develop not against her own. She develop antibodies against positive blood because sometimes the baby's blood spills into the mother's, right? Or it just goes in naturally anyway, right? So here you have a woman who is negative. When positive blood comes in, she will develop anti-positive bodies. You understand? Antibodies that will fight off positive. If she has another baby with a positive, that is positive, whether it's AB or O positive, right? She can now have those antibodies that will attack the baby.
Oh.
Do you understand? Mm-hmm. And that can cause death. that can cause death of the baby. Severe problems with baby become very swollen and dies. Okay?
Right.
Incompatible with life. So a woman who has had an O negative or whatever negative, A, B, AB, or O negative blood needs to get a vaccine if her baby has negative blood, has positive blood. You got me?
Yep.
Else she'll have those antibodies circulating. So the next pregnancy shouldn't have any problem because she would have kind of gotten rid of those positive the antibodies against positive blood if her other baby is positive.
Right. Yeah. One other question. We've heard there's a phrase that we've heard a bit growing up, something called stillbirth.
Stillbirth?
Yeah, I don't know if you've heard of that. Basically,
a stillbirth is a baby that dies in the uterus.
Right.
So like this same antibody thing can cause a stillbirth, right? It's called orbitus fetalis, right? The baby dies. The baby's dead. And there are myriad of causes. And that is why it is so very important. Your baby stops moving, go to the doctor. If your baby, of course, I'm jumping up and down like you're playing basketball, and then all of a sudden realize that he's sitting like he's in a theater, you need to go to the doctor, right? If you have had it before, you need to go to the doctor. Once a baby's movements change, you should go to the doctor. Sometimes the baby may not be growing. Sometimes you may have afterbirth, what's it called? A placenta that's not being able to get, that's not giving baby enough food, and the baby dies. And that's why it's so very important to get seen. Once a baby's movement get decreased, you need to go to the doctor. They send you for an ultrasound. Some babies just get a little tired and keep themselves quiet for a while, or because you get so accustomed you don't realize it as it's normal. But having a stillbirth can be very, very traumatic to mothers, and therefore we should ensure that we deal with it early, and because the mother still has to deliver the baby, they induce the pregnancy.
Right. Okay.
Yeah, because you can't leave the baby in there. It can cause her to have severe challenges with her bloods.
Okay. And what about SIDS?
Sudden infant death syndrome?
Yes.
I haven't seen a lot of that in our environment, right?
Okay.
I have not seen a lot of sudden infant death syndrome. Have you ever heard of a sudden infant death? You're what, 52? Have you seen? I'm serious.
No, I haven't. But mind you,
I have not seen any things in the environments in which I have worked.
But
they seem to happen in other countries. They think of a lot of bedding. There are a lot of theories, but it's not something that happens. But at the same time, right? You have to be very vigilant that doesn't happen.
Yeah.
Some of us sleep with our babies in our bed. Be very careful that they don't roll over on the baby. That there's not too many things like stuffed toys and bed linen and stuff and pillows and stuff in a baby's crib. You understand?
Right.
I saw a video today of a woman with her neonate and the baby's crying, and she probably sees it after with the newborn baby in her crib in her room, and the baby, she swaddled the baby and the baby became unswaddled. And the baby is struggling with this swaddling that's around her neck, and she's fighting, and she survived. But fortunately, she survived. Right? So we have to be very careful. And if you can't swaddle well, don't swaddle the baby. It does help them to sleep better when you wrap them tight, but you have to learn. There's a technique for swaddling a baby. You can't just wrap a blanket around him.
I know.
Okay. The other things that baby just keep it hot here. Why would you put on so much clothes on a baby? We put too much clothes and the baby get cantankerous and they cry all night because I'm just hot. Okay, he's just hot.
Yeah.
So the swaddling thing, we have to get counted. We tend to follow all the stuff that happens in first world countries, but one of the problems they think related to sudden infant death is the excess of clothing and cloths and wraps and stuff. That and the fact that, like in the winter, people probably put their babies in their beds.
Right, but Doc, and you ask about it, but I'll tell you, we have a very unique culture, very, very, very colorful, very, very colorful, and you hear things like, for example, someone just taken and they die. Have you heard that yet? The person, so in other words, okay, you get the impression that individual was normal, but they just taken and they die. And I usually, sometimes on a We Culture program, we make a little fun, and we say, that's the only thing that a doctor can cure when someone taken, because when someone taken, that's it.
Boy, you're wrong, because people take no, you're wrong. People taking to have babies.
I would like to be wrong. I would like to be wrong, but you hear that a lot.
No, people taking. She taken to have baby and she gone down. Mean that she got into labor and she has been taken to the hospital. And since St. George's Hospital is in one of the most southern parts of the country, taken to have baby and she gone down.
When somebody taken, the doctor can't find a complaint, and that is it.
No. I think the taken in, as we explain it, as we express it, it's just that sudden change in someone's physical state,
right?
And that can be sufficiently severe to occasion death. It can be a stroke. It can be a heart attack. Some cardiac, some form of cardiac death. The heart just stopped. Not necessarily have a heart attack, but the heart just stopped. You could have an overdose that nobody knows. There are lots of reasons why you sudden death.
Why you're taking?
Why you taking? And dead. Because you take it and don't dead. Okay? You can take it and
don't die. No. You can't take it and don't die. Once you're taken, that's it.
Oh.
That's why.
No. So you're taken to dead. Okay.
Once you're taken,
so it just means that there's a severe change in somebody's physical state.
Right.
That occasion. And those people have to have postmortems.
Right. Okay.
And remember that we're very private about our health status, right? We in Grenada are very, very private about our health status. So if I have diabetes, or I have, like I say, sugar, or I have pressure, or I have a cancer, and I was talking to somebody today who was saying they know a woman who died and her children never know that she had cancer. But people are like that. Okay, so when you get to that state and you might be an internal organ that is cancerous. You get to that terminal state, you go and you die. You might have excessive bleeding or something happens that ends your life acutely. But sometimes we don't really like to share. We're very private about our health misfortunes. And that is why some of us don't get help that can be had, because we think it can't be helped.
Right.
We don't want to talk about it. We're embarrassed about it. We're embarrassed at what our physical examinations are going to be like. We're embarrassed because we probably don't have money, the cost to do blood tests and all the rest of it, which, and I want to reiterate, often are, for the most part, essential. Because I can diagnose my patients now. I can diagnose my patient. We all should have that clinical acumen, that clinical skill to recognize what a disease may be. But a blood test cannot help us to hone in, and an ultrasound helps us to, come to the point, and an X-ray and a CAT scan, right? I can know that your arm is broken, right? But I want to know if there's movement in the fracture, how much movement there is, exactly where's the break, right? What should I do depending on what I see in the X-ray? There are lots of things. If you have diabetes and your kidneys start functioning badly, it's that the kidneys are so bad that they need to, I can do a dipstick and see there's a lot of protein, but I need to do other tests to see exactly what's going on. Is there protein in your blood? Is there other things that make me know, like your creatinine high or urea high, that makes me know that, oh, no, these kidneys are not working well. These kidneys are failing. You need to see the nephrologist. Do you understand what I'm saying here?
Yes.
I don't need a cardiogram. You might come and, boy, having this indigestion of belching. I said, well, your pressure has been high. Have you been? Oh, doctor, I take my medication. And I remember you check your pressure high. When you check, your heart is not working well. So there are all of these things that we have to take into consideration. That it may not seem necessary but it's actually essential.
Right.
So you can in on the person's diagnosis. And like I say, sometimes the tests that we have to do would be things like doing a CAT scan with contrast. So a CAT scan is a kind of sophisticated ultrasound, right? Put you in a little machine and they take pictures at different, like on a page, one page, right? Or you have different pages in a book, take it at different levels. So they're taking pictures at different level of whichever area of your body, right? But sometimes they have to put a contrast. So in taking these pictures, you can figure out if there's a mass or a blood vessel that's broken or whatever it is, right? Where exactly it is, how widespread it is, what it is compressing, all those things. So you get to do a contrasted a CAT scan of contrast or MRI, which is a little more sophisticated, similar to a CAT scan, a little more sophisticated than that.
Okay, lovely. So let's talk a little bit about.
The truth is, they cost, and I want people to understand. They're costly, but they give your doctor an idea as to exactly what is more exact than he can throw a ballpark as to what is going on to be able to take the right moves, right? To make you comfortable, to preserve your life, to get you better, whatever it is, depending on how you present.
Okay, exactly. Lovely. Right. So let's talk about now that period of infancy, from birth to about a year. And during that period, we know that the development of is really, really fast. Children, they start learning their basic reflexes. They start getting familiar with things around them. They start moving around, walking, biting, doing all kind of funny things. But even during that period, there can be complications. And one of the things that I have heard about and probably familiar with and close to is air infection in children in infancy. So while a child may not probably have maybe pain or be crying or so, how are there any other signs that or markers you can identify to sort of?
A baby cannot tell you that his ear hurts, okay?
Right. And
often with ear infection in the children is either the middle part of the ear or the inner part of the ear, right? And the babies, what they will do, they'll keep pulling the air. They often pull the air, right? They may have fever, but sometimes the children have a cold. There is communication between the nasal passage, the back of the throat, and the inner ear. Right, the inner part of the ear. So if you have a respiratory tract infection, nose, throat, sinuses in the face are not yet developed at that age, right? So let's say you have upper respiratory tract infection, you have a cold in your nose and sore throat, which you can get, right? Sometimes the air gets infected. A lot of us think that we have to give baby antibiotics. No, you do not, unless there's certain signs that the doctor would look for. Right? A baby who doesn't eat, a baby who has severe fever. Do you understand? Because a child might still take his bottle if you take away the pain. Right? But if the baby, you give him the analgesic, might be a couple drops of Tylenol, and only Panadol, please, right? Or Tylenol drops. The baby eats and he starts to play with his little friends again. That's a different story. A baby who's flaccid, who doesn't play, who's not animated, who doesn't take food, it's a baby who's quite sick, and you have to take him to the doctor. He may require antibiotic, depending on what doctor sees.
Right.
And you want to also treat this upper respiratory tract infection because you don't want the baby to get infection in the brain and along the sheath that covers the brain, right? The meninges.
Meninges, yes.
Right?
Okay.
You don't want a baby to get meningoencephalitis, even viral, and that happens. So if you're concerned, take the baby into the doctor, right? Because these passages are very small in the children; they're very short, so viruses may enter and cause the baby to have an infection, right? Look and see.
Okay.
And baby might want to take feed, but it might take breast. But once your baby have a fever and you can't get it down, and don't be afraid to sponge that baby and put the compresses on the baby's temple, because you don't want your baby, especially the babies over 6 months, you don't want them to start having seizures when they have fever, because that will cause damage to their brain and can hamper their learning later on.
Okay, lovely. And of course, as I said, some of the basic reflexes and that they learn to move their hand.
That is all done when the baby is born, eh?
Right.
When a baby is born, part of the evaluation is looking for the reflex. The more reflex, you take the baby hand and put it, and he pulls it back. You drop him and he puts up his hand in the air. There are a series of reflexes you have to do. You also have to do what we call an APGAR score. What you see when the baby is born, the breathing, the color, the skin, what the heart rate is like and stuff. And then you do it at 5 minutes. Right? So you have an APGAR score of 610, whatever. You understand me? So that's part of the neonatal evaluation, where you check the baby's APGAR score. So if you have a baby who's born and doesn't cry immediately, that's probably 2 points off already. Because everybody bawls when they come. This is not a nice place, especially since some of us hear about that man.
Right. Put me back. I want to go back.
I want to go back.
Yes, indeed. And of course, the baby starts developing into toddlerhood. Where they start walking, and they start trying to mimic, the talk. They hear mommy talk, they hear daddy talk, so they start trying to say all kind of different things. They learn to eat and, do little things, of course, with care and all of that. What are some of the...
So there are times during that, from that one baby to one, that you have assigned trips to the doctor where the baby gets his shots. I don't have the schedule here, but there's a World Health schedule where you get a certain amount of shots by the time you're 1, and then by the time you're 4, they're boosters up to 4 years of age. One of the things is the whole feeding thing. Look, they're asking us to breastfeed our babies up to 2. Granted, some of us have to go to work, but we can still extract and make baby have some food, okay? They want us to breastfeed baby exclusively for the first 6 months, but we have to go to work after 3 months. Remember that, right? Because maternity leave is up to 3 months. So I guess when we get as advanced as France and Canada, where mothers can stay up to 2 years, or they can stay if they want, and get support, we'll be able to do that. But it is very important that your baby is breastfed during those first 6 months of his life. You don't want to give your baby sugar. As a matter of fact, you're not even supposed to give the baby water for the first 6 months. Because if you're giving him breast milk, it has all the water that he needs. Okay? If it's hot, you breastfeed him a little more frequently. You certainly don't want to give him juice. And I know Grenadians like to give hot water, tea, and put little X and Y and Z in a bottle. No. That's already introducing our children to sugar. And a lot of us do it, and it was done when I was a child, so the baby feels satisfied and go to sleep. After 6 months, you can start to introduce other things. Boiled carrots, try a little bit and stop. Boiled pumpkin, a little bit and stop. The yellow of the egg, the baby cannot digest the white of the egg, so don't bother give him, okay, until he's a year old. No honey until the baby's a year old, because there are bacteria in the honey that can actually cause a baby to have seizures, okay? So no honey, as much as you love your baby. You're not supposed to give him anything sweet anyway, unless you want to give him a little piece of fruit, okay? Tiny piece, see how he does. So every time you introduce something new to that baby, you watch for a day or 2 to see that he doesn't have any reaction to it. If he doesn't, then you can give him a little more, okay? We have a lot of fruit around. There's no need to buy Heinz bottled fruits, okay? There's no need to give our children sugar-sweetened beverages and cookies and all of that. No, thank you. All right? Sometimes mothers will give baby one of the hard crackers. We don't even have hard crackers anymore. Remember we used to get those hard crackers? Yeah. The water crackers that when the baby's teething, right? You give him and he rubs it on his gum and he suck it and he swallow it, and right? Get a teether. And please, no pacifiers. Please, no pacifier. I don't know where we get this pacifier habit from. It's bad for children's mouth. It's very bad for children's mouth, etc. Picking up germs on the ground, okay? It falls, the baby pick it up. Or a bigger child take it and borrow it from him and then give him back. No, you don't want that to happen. We've seen it, and it looks like it's cute when you see these reels on TV that the big sister take the passy and puts it in her mouth.
Mm-hmm.
Okay? No. Not allowing people to kiss your baby on the mouth. Especially babies that are unvaccinated. We've seen a lot in populations where there's low vaccine that babies get whooping cough.
Mm-hmm.
Right? And they can die because they don't have any the immune system are so very low. So those are some of the things, and that's all caring for your baby.
Yeah.
All right?
Yeah, there's something I wanted to ask you earlier, and it did slip me during pregnancy. I haven't heard of it here in Grenada. I've read about it. I know of someone who had unpleasant experience with it. The whole issue of German measles during pregnancy.
So if our population who is having babies now should not have German measles.
Right.
Because everybody gets MMR, measles, mumps, rubella. Rubella is German measles.
Right, yes. Mm.
And I know there have been German measles. There has been German measles here. There was an outbreak, and this is an endemic zone. So an endemic here, meaning that the virus exists around here. So okay. I remember 3 cases in the early days of the revolution.
Right.
And you usually ask to terminate the pregnancy because the babies can be born with severe deformities.
Deformities, yes.
Severe, yes. Cardiac, physical, learning, especially heart, right? A lot of problems. So that's German measles.
Okay.
I haven't heard of German measles here. Maybe they are, and I don't know, but I have not seen any reported.
Right.
And we I've not heard
about it.
We have German measles because our population, our young population would have had MMR. And even us, when we go to university and stuff, you have to have MMR, measles, mumps, rubella.
Right. Yes. Okay. Lovely. I just thought I should but I haven't heard of it. But I just wanted to, just put it out there.
I think this is a good time for us to invoke again or evoke again the whole issue of vaccines. Our vaccine uptake has dropped to unacceptable levels, right? You'd want to say, it's just measles, and the child will get over it. But there's a lot of scarring that can occur on the brain. You can have pneumonias, and in small children, you can have a lot of remnants, a lot of sequelae that remain, especially on the central nervous system and stuff, right? And affect the child throughout life. And I can't understand why we would allow our children to have diseases that we can prevent. Right? Remember, that is why our grandmother and our great-grandmothers, you and my great-grandmothers, would have had challenges with their children dying, their little ones, because they had a lot of diseases that are now considered vaccine preventable. Okay?
Definitely. And of course, we haven't seen the pox and so in a long while. That one is the chicken pox and things like that. Is it still around?
There are vaccines for chicken pox. Yeah, chicken pox every so often, and chicken pox can cause you to have shingles.
Right.
And there are vaccines for chicken pox, but it doesn't come on a regular thing.
Okay, wonderful indeed. All right. And okay? No, I thought I lost you there for a moment. Right. So we actually getting close to wrap up, but I want to just move on to and maybe that can be the last segment for this evening programs. So the area of childhood, 3 to about 11 years, and some of the challenges.
I think we should look to 4, and then that's preschool, and then we can look at the school age, which is 4 to 11, 10.
Right, yeah.
But
and some of the challenges that the child can face there, and
how a lot of development. But remember, children fall along and they break their foot, they break their hand, and they do all this stuff. It is what is important at that time. Again, children's safety, physical, sexual, mental. Those are the things we want to make sure they live in environments where they don't have to deal with that kind of stuff. Right? There's early childhood learning facilities, or children should be exposed to their friends. And of course, they must have their vaccines to prevent them from getting stuff. It is important. The more of vaccines, the less the possibility of having vaccine-preventable diseases. You look at childhood development, mental development, physical development, those things. We have children that have hearing and visual problems that have to seek out special help. And there is special education for children who are special and need support. So not keeping our children at home, but putting them out there so they can be part of the bigger world, you know? Keeping our children from too much TV and too much the iPad and stuff. You only need to keep your child on half hour. Even when you watch Miss Rachel, it shouldn't be very long. Your child should not have those problems. So should not be on the internet very long because it's bad. It creates a sense of addiction. Okay? So we need to focus on that, on those things. What is good for our children that we'll give them. Nutrition. Because what children learn at home, they will grow up with. If we eat highly fat, sugary foods, sugary drinks, you understand? Highly processed products, our children are going to grow, because we want to make sure that we focus on obesity from a child is born. That's why breastfeeding is important. And we know breastfeeding babies tend to be chubby, but by the time they start to run around, that fat goes. All right? So we want to make sure that we can give our children that good start. So when they come to 14 and 15, their blood sugars aren't high, their cholesterol isn't high, and all of the things that we've been seeing way too premature in our younger population.
Right. So,
and of course, there is vaccines until our children go to school, and there's one more vaccine, like about 12, where they boost tetanus and a few others, 1 or 2 others.
Okay, lovely indeed. Yeah, and some of the what I would like to call maybe social challenges. So at that age, they're 3, 4, they're in school, they're running around, they're gonna fall along, they're gonna bruise up their knees, they're gonna bust their heads, they're gonna get bust. A lot of things can happen. They're exposed to burns at home because they move.
Children don't get busted anymore because they don't spring stone after mango. Sorry.
Well, yeah, you're right. Yes, yeah, you do have a point there. But
so one of the other things I wanted to tell you, because we used to talk about getting warm medicine. I don't know if your mother gave you warm medicine when you were small.
All the time. In fact, you would get these things from your grandmother. Your castor oil and all of this kind of warm medicine and so.
And acifetida, Tyrax. But now you have Bermox and Zentel, and I'm not doing ads for them.
Your grandmother had given you that. Yeah. Your grandmother had given you that, not your mother.
And Senna.
That one. That one.
No, seriously though, I want to recommend to all families that everybody in the family gets a dose of worm medicine when school about to open every term. So like now, when we go back from the Easter term and when we go back from the summer term, because our children are very intimate with each other. They don't wash their hands, and it's passed by, a child go to the bathroom, don't wipe his hands, he don't wash his hands, he might have worms. He come and he share his sandwich with his friend with all good intentions, right? So you want to make sure that all the children, if all the children get their worm medicine, the chances of having worm, and adults have to get a worm medicine as well because the children will infect you, and you get it from the people who work in your office. So I would recommend highly that people who have children with that people who have children and who work, everybody take worm medicine every so often.
But does it work?
Yes, it does.
From what I heard, only one thing could kill the worms, but that's a different program.
But kill the worms is the worms want to die. That's what you call worm medicine. Because worms will cause your children to get anemia. If you see a child eating rock stone and things that people don't eat, ice and stuff, they're probably anemic. And it's probably not just nutrition. It's probably because they have worms that use out all the hemoglobin.
Wow. Okay. So when women eat things like cliff and charcoal,
because they're anemic.
Yeah.
And I would treat my patients. That's called pica, where they eat strange things, paper, charcoal, and there's choice pieces of clay. They know exactly what's going to get a right piece of stone. Yeah. That's called pica. And I will treat my patient. Look at a stool, right? And I will also give them worm medicine and as well.
Right. Okay. Lovely. So, Doc, I tell you what. I think we've done well. We've covered a significant amount. So, what I'd like us to do now, because we're almost out of time, maybe just do a very short summary of the discussion this evening, and then we'll break for tonight and continue next Tuesday.
So, we're making good people. Okay, we want to make a healthy population. And we've been fighting so much with chronic diseases, and we have to realize that chronic disease and all diseases, most diseases can be eliminated from the uterus. Mm-hmm. And by extension, in the person who is the mother before that. So a woman who wants to have a baby should put herself into a state of health to have a baby. A woman who becomes pregnant, even if she's not prepared, should make sure that she attends antenatal care to the T's. Okay, it's available, it's free. If you want to go to a doctor or you pay, that's your business. But it's available and free and very scientific and run by people who know what they're doing. Okay? You also get a tetanus shot during your pregnancy, right? And you look, everything is looked for that can be detrimental to your baby. So we need to make sure that we put these babies into cocoons, these fetuses into cocoons that are healthy for them. Right? Mm-hmm. Cocoons where they can get good nutrition, where there's no alcohol and drugs and tobacco and all the rest of it. And the food that they get is nutritious. Okay? We want to make sure that we do all our blood tests, even though it looks like too much. And of course, that our nurses follow, so we don't have hypertension and diabetes in pregnancy. We want to look out for any changes, anything that can hamper the size of our babies, the health of the babies. Is he growing too fast? Is he growing? Am I well? Whatever it is. We want to make sure all of that. Okay? We want to make sure mothers keep active during pregnancy. And pregnancy should be free of stress and stuff. So us as families should really help. And once that baby is born, women should already have the mind that I am going to breastfeed my baby. Unless I have some severe chronic disease, I have cancer, I have HTLV1, HIV, those kind of things where you shouldn't breastfeed. And your nurse will tell you, if you go into antenatal care, your nurse will tell you when you cannot breastfeed. Okay? Mm-hmm. You want to make sure your baby is born in a hospital setting and that that everything is taken care of. Okay? And in that first year of life, it's so crucial that nutrition is good. Breastfeeding is still the best. And where there isn't, you must be guided by the nutritionist as to how to feed your baby so that your baby becomes a healthy child, especially up to that 1 year, which is so crucial. There are a myriad of vaccines that your child requires so that he can stay well and he can live. He can live to become an adult. His life expectancy can be wide. But that is also teamed with what you feed your child. What kind of environment your child grows up in. If your child grows up in a violent environment, you're going to have challenges. If your child grows up in an environment where there's no running water and there's cockroach and sandfly and he's prone to, and cockroach especially, and he's prone to asthma and all of those things, right? you take away his chances of having a normal, healthy childhood. And healthy childhood doesn't mean that your child have pretty clothes and nice toys.
Right.
But there's stability, there's emotional and mental and psychological stability in the family. And sometimes we don't have both parents, but we have a lot of extended parents, a lot of extended families. And that they must encourage a mother, and give her that space so she can breastfeed. And like I said, we're lucky in a lot of our countries that we have maternal care, maternal leave. So mothers can have 3 months with their babies. They get paid fully 1 month and then half pay the next 2 months. They don't want to go to work, they don't have to. Okay? But what I'm saying is that at least we have those first 3 months of bonding. Soon we're going to have paternal care where men can also get a chance to be with the families. But breastfeeding is very important. What you give your baby to eat, right? Stay away from the things that are not good. The pretty color food is no good. The bag make noise is not good to eat. Trust me. Okay? No processed foods. We give our children, and those aren't even called foods. All right? And that is something that after a child is 4 and gets into primary school, you're going to have to explain to him that this is not good. Our families are going to have to eat like all of us should eat. Mm-hmm. Remember before we would have the diabetic habit part, the high blood pressure? No. The family part must be healthy, right? Why does the person with diabetes have a different part from the person when we all should be eating healthily? Okay?
That's right.
The Food and Nutrition Council is there to help us. Keep our children active, running up and down, playing, good, skin care, physically they must be paying. Look to see if your children, make sure your children don't have seizures, make sure they don't have asthma, make sure they don't have, especially those 2 diseases. And if they have sickle cell, there are limits within which. But there's a sickle cell clinic for the children who have full-blown sickle cell. But there's information, and there's information in that favorite thing, that phone. Just Google it, and and there's everything. Look, we don't need a lot except each other's support and decent food. And we as other citizens who may not be the person who is having a baby must support and respect people who take the time off to have a baby. It doesn't really matter how much they have, that's not our business. But at least support and encouragement and ensuring that facilities are met. And mothers, please use the facilities. They're there. You miss a period, you go to the doctor.
Right, yes indeed. Well, Doc, thank you so very much. That's all the time we have tonight, and thank you to all our listeners or viewers for staying with us. I really do hope that you were able to pick up a few things. I picked up so much, and this is great. This is great. So we will continue next week because we have to continue the life cycle, get into adulthood and of course into old age and all of that, because throughout the entire life cycle there'll always be ups, there'll always be downs, there'll be left, there'll be right, there'll be everything, and we have to take charge of our wellness to make sure that we're enjoying the best possible health. So we look forward to being back with you next Tuesday for another Doctor on Call. Doc, thank you so much. Don't forget, tomorrow at 6 you can join us for Managing Your Money. Mr. Devon Charles, financial specialist, will be joining us, and tomorrow we're looking at budgeting. How do you prepare a budget? There are some steps that you need to take. It's not just deciding, well, all right, I'm putting aside X for that or Y for that. No, there are steps you can take. So we can look forward to that. Tomorrow, 6 o'clock, Managing Your Money, and then a little later on, Kaiso Talk. So do join us. And of course, on Saturday next week, the 31st, GBN's Oil Dung Fest takes place at Pearl's Estrip.